Right, so hi, I'm Tony. I've made this video. I was a dentist, but I'm after your feedback as well. So, this is how I think I can help you. And the first thing is to say that if you are an oral health champion or ambassador, they keep changing the name, then these are two brilliant resources. So, Knowledge Oral Healthcare, I've known them for a long time, and they provide fantastic courses, and as does on FutureLearn, that has lots of courses for many things. It's open university based, and this Mouthcare Matters, you can do the course there as well in your own time, and to a large extent I'm sort of mimicking it, but it's you get certification, and that's always useful to have. So moving swiftly on. Oh, indeed, moving swiftly on. So this is just an example of saying that when you get on the flight, it always says, look after yourself first before you look after the children. Right? Well, in the same context, if you're looking after your residents, are you looking after yourself? And so this is what this section is really about, is are you looking after yourself and how I can help you. So I've made lots of videos over the years, and I made this one, it must be 6 years ago, but I'm not showing this video, but basically the benefits of the videos are they will save you time and money, and you're less likely to have dental pain if you look after your mouth well. And it is difficult to get a dentist now, especially on the health service. So this should help you, and as it says there, but also it should help your family. So the resources here that are freely available for everybody, and ultimately what we're trying to do is to help the residents from your care. And the references here, there's nice, as you can see, and CQC. Well, these documents are about 60 pages long, and a lot of it is irrelevant. And so I'm just trying to make stuff that's relevant for you. And this is more or less up to date, and this was from The Economist, and there are lots of references there. Again, it's about 60 pages long, but it's evidence based, as you would say. And we now know there's a strong association between all manner of diseases. That the last count there are 57, which remarkably coincides with Heinz Foods. Mouth disease such as periodontitis and gingivitis, they're called comorbidities. So they sort of, if you have heart disease, often in your mouth, you have gingivitis, and it's this kind of relationship. And so these are a couple of the comments within it that are highlighted. And so you will know this, that people in residential care are more likely to have aspirational pneumonias due to poor oral hygiene. And it says here, because their mouths aren't being cleaned. Well, there's a limit to what you can do in the time available. And so this is to try and help figure out how we can help one another and save time and just provide really good care under the circumstances that we have. So this is another thing, is that the more we know about gum disease, the more we know it's up to the individual. And you're in a great place to help these people. You don't have to be a dentist to help stop disease. Dentists are only needed when it's gone wrong. So this is a video. It's quite old. But disclosing your teeth is the best way to check. There's no point in having the most expensive toothbrush if you put it in the wrong place. So here we have a hygienist from a few years ago just showing how she's disclosed her teeth. Most of you will be familiar with this, with disclosing tablets. I think the solution's better, and I'll work out a way that you can use it with your residents. You can see there's a variation. So this person was left-handed because the left side isn't cleaned as well. And then you can use these mouth mirrors, extremely cheap and really useful for you to navigate around the mouth. Now, from an individual point of view, I think this is something you should be doing, far more so than floss. But I think it's going to be really difficult for you to do it with residents. And this is what you're looking out for. So clearly I hadn't done my teeth very well, so I got some bleeding, and that's a sign of inflammation. And if you wipe it on a tissue, you can check. Now, if you smell it, right, well, that's a sign of disease. So that's anaerobic disease, and you don't want that. I've made a test for that. Well, I haven't made a test. I called it the Smith test. So hopefully you'll come across that. It's a sign of disease and inflammation. So this is another video. So I know this is a longer one, and so stop and start it if you miss it, because some of my audio doesn't quite work with the text, but it'll give you a good idea of what you're aiming for, because nothing's changed that greatly. This video is to help support you in cleaning your teeth. Now more than ever, we want to keep our mouth healthy, as having a healthy mouth means we have a healthy body, and who knows, it may help with our immunity. So now we say clean your teeth around breakfast time, but it's last thing at night is most important, because then your teeth will be covered in toothpaste rather than anything you had as supper. So to clean your teeth, the easiest way is to divide it into segments and just get a kind of a set routine that works for you, but ensures that you clean the whole mouth. And you do need the full 2 minutes twice a day. It's a good regime to have. And the reason is shown here. Bugs. And in the mouth we call them dental plaque in the past, and now it's termed biofilm. And so what we want to do is to keep these bugs that are in our mouth, the healthy ones, and that's why we clean our teeth. If we don't clean them regularly, what can happen is that the biofilm or the plaque changes, and then you get these good bacteria change into bad anaerobic bacteria. And what that basically means is you get a reaction, a bit like asthma in a way, in that some people react worse than others, and you just don't know if you're one of the lucky ones or the unlucky ones. But certainly if your gums are bleeding, you're more prone to decay, and in some instances, well, the bone disappears as well, and you'll end up with loose teeth. And of course, there's no point cleaning your teeth unless you do it correctly, and really we should be saying clean your teeth and your gums. And when you clean your teeth around the gums, you're trying to remove the plaque. If you hold the brush at this angle, then it won't clean down into the gum margin, and the gums will just continue to swell up, and that's when you can start to lose the bone. So look in the mirror and make sure you're holding your toothbrush at the right angle. Generally we prefer power brushes, and for some of you interdental brushes will be required, and you can see videos on them elsewhere within the dental app. For manual toothbrushing, it's easier if your teeth are in a straight line, which is why we like orthodontic work. So if your teeth are a bit crooked, you have to try just a little bit harder. It's the same with your power brush, you just have to move it around the teeth, holding it at 45 degrees to the gums. Finally, clean the tops of your teeth, and always remember to tip it at the back around your last tooth or your wisdom teeth. The latest brushes are extremely good, but they're no good at all if you don't really put them in the right place. A good way to check is disclosing your teeth. We always recommend it for children, and you could do it yourself. There are other videos within the app showing you how to disclose your children's teeth, and just have a go too. Any trip to the pharmacy or the supermarket shows you a multitude of different toothpastes and mouthwashes, but it's the brush that does the work, and many make claims that really are difficult to justify. The slurry that you generate when you clean your teeth is better than any mouthwash, so just swish it round your teeth and then spit out. If you must use a mouthwash, then do it at a different time to when you clean your teeth. And those that claim to reduce the bleeding, as you can see, it's the brush that can reduce the bleeding. The mouthwash just disguises the problem that lies underneath. And if you haven't got a power brush, I'd recommend one that's rechargeable. Always get one that's got a relatively small head and doesn't mimic the classic design of a manual toothbrush. And the latest development with a toothpaste is one that has less fluoride, but it lingers around your mouth a lot longer, and so this is the one that I would recommend. When it comes to general health, prevention is better than cure, and keeping your mouth healthy will help keep you healthy, and as I said, it may help with your immunity. So you can see there that I keep mentioning an app, and I made an app for my patients. And the other thing is that more recently there's a toothbrush that's come out that I really like, that is very big, and that's, well, that'll be within the next videos, I think. But anyway, so you can download the Teeth for Life app for yourself and the family, and ask your dentist for your BPE. So unlike your blood pressure, which you can measure digitally yourself, or your BMI, although we're not so sure about the BMI, but it's certainly about your weight, Yeah, and if you put in your details and your risk factors, it shows you how likely you are to lose your teeth from gum disease. It also shows you the likelihood of mouth cancer, and really you should be checking yourself for mouth cancer once a month. So you can put reminders in it for that. And there's a way of scoring your mouth. So there's disclosing, and I put in something, the bleeding score. And so if you can't get to see a dentist, at least you can monitor yourself. And as it's got there, try and keep in the green. So yeah, with time made a lot more videos, and it's got easier to make the videos. And some obviously look kind of better than the one I showed you before. And that the other ones, they took ages to make, but they're actually quite useful, I think, in that it demonstrates what you should be doing a little bit better. And people are nervous about looking at other people's mouths, so maybe that's a better thing. You can let me know. So yeah, if you look on the website, it explains the BPE. I think that's what the next one, and how it's related to general health. So now we think there are 57 diseases related to poor oral hygiene. And that nicely coincides with Heinz, 57 varieties, isn't it? It's probably 58 now. And so over Christmas, I made a series of videos. As you can see, not many people look at them. But within one of them, it's called the Smith test. And that's where you saw that test. Well, it wasn't so much a test. It was me showing you how to use a dental brush. And that's 6 years ago. But now, it's far more prevalent that we know about the microbiome, our own gut microbiome, as well as the oral microbiome, and how are they related, and how these bugs go from our mouth into our lungs and into our bloodstream. And I got that in the video from 6 years ago. But anyway, have a go at that test. I think it's quite good. And please look at the videos. If there's anything that this isn't just for care for your residents, it's for you and the family. And so I think I did another video here, which is basically, if you type in anything on the Teeth for Life YouTube channel, then it should bring up, what you want. And that's what I'm trying to work on at the moment, putting SEO on this, so that you get the right videos. And it's also on the websites and trying to do the same thing. So this, again, is interesting because the chap that gave this lecture is called Professor Ian Chappell. And this was October last year. And basically, if you look at it, the number of disease sites, the higher it is, the worse your gums are. And also it shows how more expensive things are. And we know that the best reduction is from oral hygiene that can be carried out from a dental nurse. There's no reason why a dental nurse can't come to help support the oral health champions. Obviously the hygienist can come, but it's difficult. The more equipment that you have, the best things have not needed. And then finally the dentist. Well, you all know it's quite tricky to get a dentist to come to a care home or your home, but there are people trying to do that now, but it's just you can't really have it on the health service. And so finally, where do you fit in? Well, I would say you fit in here. You're I hate to say it, but you're probably not as well paid as many of the dental nurses, who aren't as well paid as the hygienists, who aren't as well paid as the dentists. So there's a hierarchy, but as you can see, the people who have the most effect are paid the least. Yeah, don't blame me. But anyway, when it comes to helping you, you can help me in that I've never worked in a care home. I will be coming around some care homes and trying to work out how we can help one another. Because in dentistry, some of the best innovations have come from people who've been outliers or not worked in dentistry at all. The person who's had the most effect for improving oral health worked in advertising and invented a toothpaste that had no benefit whatsoever other than to make your mouth feel better. It didn't have fluoride in, but what it did do is it encouraged the people to clean the teeth with the brush. And as it said in the video, it's the brush that does their work. So we'll be asking people for their feedback and what they like and don't like within these videos. And I'm not sure if that's the last one. Oh no, it's not. So, and I have made another dental app which is called dentalhealthservice.net. And oh yeah, I've been trying to. That was an effect I shouldn't have had. Right, but please look at these things. And so there are other things that we'll be talking over the next, I think there's probably about 5 other, hopefully short videos that you can look at. And there we are, that's what I have built as well. So look at that one, that's more, this is specifically for carers and for care homes, but this is for everybody. And it's free at the point of contact. As the dental health service, as you know it, falls apart, prevention is the key. It's just how can we make prevention pay? And that's the silver bullet. Nobody wants to see the dentist until they have a problem. We need to reduce the problems.